My name is Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, treatathon, the lupus day. Can sleep affect your sexual performance? Watch and listen. My name is Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, treatathon, the lupus day. I don't know whether you've noticed that recently there have been increased cases of stroke in young people. Initially, stroke used to be the disease of elderly, but now we've been seeing it mostly in young people. Another very common disease that we now see in young people is sexual dysfunction, erectile dysfunction, inability of the penis to maintain erection for at least 20 minutes. It's been very common in young adults. Initially, these things were initially only associated with the elderly, but now most people from 40, even down to 25, are now coming down with these things. Last week, I had a patient, two patients actually. The wife, actually, it was meant to be the wife that's sick, but the husband, their husbands accompanied them. Then I noticed that the first one kept telling me that the husband snores a lot. And in fact, as if that one is not enough now, even to perform very well in the night is becoming a problem. The next patient came and was telling me her own husband's own is even worse. The husband is big and getting bigger in size, and recently just discovered that the husband has sugar, that's diabetes, and to worsen it all, the husband doesn't perform well in bed. Now, these people I'm telling you are just like 45, 44 years old. Okay, so today I'll be talking about snoring. Deep, of course, there are mild, moderate, and chronic snoring. That is deep snoring. So I'll be talking about deep snoring and how snoring will affect sexual performance. So the theme of my speech today will be snoring, how deep snoring can lead to erectile dysfunction. So let me start with snoring. What do you really know as snoring? Okay, so now I made a little literature on that. Snoring is a noisy, vibrating breathing that occurs when you are sleeping. You are sleeping, you'll be hearing noisy, vibrating vibrations that occurs when you are sleeping. So let me just give you the risk factors and causes. Now, it's common in people that have the family history of snoring. Now, that means if your father or your mother is snoring, it's likely you might come down with snoring. It's also common in people that are alcoholics, especially people that drink alcohol, drink heavy dose of alcohol before sleeping. It's also very common in people that are oversized. Of course, we know that one very well. Or people that have been deprived of sleep for a very long time. It's also common with people that are that have structural or anatomic defects in the nose. Maybe the septum, the nasal septum is deviated. It's also very common in people that have narrowing of the airways. That one is quite very common, either due to, especially in children, either due to large adenoids or large tonsils, or people that have the muscles of their throat, that is the esophagus, the muscles from the pharynx down is lax, with the muscles of the tongue being lax, such that it now collapses and makes passage of air difficult. It's also very common in people that have large, very long, long and soft palates or uvula. That is people you can see snoring in. Okay, now, one particular aspect of snoring I want you to take good note of is that snoring is commonly seen in people that have what we call obstructive sleep apnea. Obstructive sleep apnea. So now, if you are having obstructive sleep apnea, apart from deep snoring, these are the likely other symptoms you will be experiencing. There will be pause in your breathing in the night if you are asleep. At a time your breathing will stop and then it will start again. There will be excessive daytime sleep because you've not slept enough in the nights. You'll be having a sleep wake. So it will lead to exhaustion and you always be feeling sleepy in the day. Then there will be difficulty in concentrating because you are oversleeping in the day. There will be difficulty in concentrating. There will be sore throat. Your throat will always look dry. There will be gasping and choking at night. Of course, just because of those risk factors I mentioned, like your throat being lax, your tongue muscles being lax, so they can just fall back and make you feel choky. So you wake up. All these things will still lead to waking up. It can lead to increased blood pressure and chest pain, and then several other things. So when you are seeing all these things, if you are snoring and you are seeing all these things, it just means you are having obstructive sleep apnea. Good. So now the next thing I want to go into is erectile dysfunction. Of course, I've told you what erectile dysfunction means: inability to maintain an erection for a subsequent number of minutes. So now, let us go into the mechanism of erection. What is really involved in erection? Now, when it comes to the penis naturally, the penis is naturally a flaccid muscle, except when stimulated. So it's always flaccid. The normal anatomy of penis is that it's flaccid. So now, what makes it flaccid? What makes it limp, like it's limp, is when the smooth muscles of that cavernosa, that penis, the smooth muscle is contracted. That's the contraction. Normally, contraction should lead to something being strong, but in the penis, the contraction leads to the penis being flaccid. It's paradoxical. Okay, so now, when erection is about happening, two hormones are involved. The first one is the hormone we call acetylcholine. The next one is the hormone we call nitric oxide. The acetylcholine is produced by parasympathetic cholinergic nerve fibers. They produce acetylcholine. The other one is the nitric oxide is produced by non-adrenergic, non-cholinergic nerve fibers. So they produce acetylcholine and nitric oxide. So what does this do? What they actually do is they relax the initially contracted smooth muscle of the penis. This relaxation leads to blood flow pouring in to the cavernosa, pouring into the venules of the cavernosa. This blood pouring in, what does it do? As the blood is pouring in, the blood on its own relaxes all the smooth muscles. Blood will now be moving. So the subtunic venules of the cavernosa will be blocked, preventing that blood that is coming in from flowing out. This is the volume 1 of how snoring can lead to erectile dysfunction. Watch out for volume 2. Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, Tretaton, the Lupus Day, the Lupus Day, the Lupus Day. Watch out for volume 2, the Lupus Day.